is a dashboard that is on the department's website, ODMHSAS.org, and it has information about what kinds of calls are coming in, what they're related to. And the number one reason for calling is thoughts of self-harm or suicide. And that's a little over 30%. I want to say last I looked, it was 37% of the calls were around that. And it sounds odd for me to say this, but that's fantastic because Oklahoma has stubbornly high suicide rates. And what we really wanted to be able to do with 988 is to have this easy access for people to reach out and get help. Yeah. So the fact that a third of the callers, that is the predominant reason they're calling, makes me think we're making a difference in terms of suicide and linking people to care. So it's really turned out great. And the number one type of caller is someone who is calling for themselves. So number two, I believe, is family, calling for a family member. Mm-hmm. But the number one reason, dramatically different from number two, I mean, in terms of percentage, is that people are calling for themselves. And that can be youth or adults across the board. So far, we're really liking the data that we're seeing. It's really working exactly how we would hope that it would. And then what happens when someone calls is kind of twofold. Now, we had a mobile crisis system for kids in place in Oklahoma. But that number was a very long number, and a lot of people didn't know it. And so what we have done is really taken that evidence-based system that we worked to develop, and now you can link to it through dialing 988. And it's a little bit different in that when you call 988 and it surrounds a youth, then the youth and the family can define what is an emergency to them. It can be as simple as, my son and I are arguing because he won't do his homework. If that's an emergency to you, that's great. We're going to take all the time that you need to work through that. And then if you would like a mobile crisis response on the youth side, we go out. It doesn't have to be a danger to self or others or anything like that. We go out. And we'll spend time then in the home with the family, with the youth, and try to bring a resolution and pull things together. And then what is different on the youth side is then that team stays with that family for 6 to 8 weeks until they are thoroughly engaged in whatever care it is that will support them for the long run. So that team will continue to work with the family, continue to follow up with the family, to really make as smooth and warm a handoff into additional care and treatment as possible.